the word depression is sometimes misleading.
I was going to say,
because a lot of the time I don't feel sad. Yeah, I struggle to get out of bed in the morning, and sometimes I do feel like either not quite life isn't worth living, but yeah, what's my purpose? Why? Yeah. But I can have a laugh. I can go out to the park. I can get on with things, but there's just something missing.
I was always able to assign it to something else. So I'd go to the GP and oh, maybe you're anemic, but I'd have all the blood tests. I'm not quite anemic. But then we sort of struggled to conceive our first child. Then we had him pregnant again within 6 months. Well, that's why you're feeling down. It was just really easy for myself and GP and everybody else to say, well, of course you feel like crap. You know, you've got these like big things happening.
Do you think you knew deep down that it was something more than that?
I knew, I started to realise it was something more kind of at the beginning of this year, because at the start of summer we were all sat around having tea, and my husband reminded me that he was staying on to do an extra task at work, and I just lost it. Just completely lost it.
I'd just come out of uni, I'd started a pretty serious job. It's the sort of thing I'd always been working towards. Everything in my life was as good as it could reasonably expect it to be. You know, I had a really nice girlfriend, I had a job that I really enjoyed. 6 months into it, I couldn't do it anymore. And it was actually my boss who recognised it in me one day, pulled me into his office and just said, take 2 weeks off. And I came back after 2 weeks and he was like, right, next project, let's get on with it. And I just could not do it. You know, I spoke to sort of some of my closer friends, people who understood me a little bit better, and that's really the first point when I was like, there's something wrong here, because there's nothing tangible for me to pinpoint, this is why you feel like this.
Do you recall like how you felt, what you felt? Was it just a hopelessness or confusion?
It was,
or?
I mean, all of those words would apply, I guess. Apathy is a good one. I've got to be completely honest, I wasn't particularly understanding of people that experience depression or any kind of mental health, not through any prejudice, I just never experienced it before, and I didn't see myself as someone that fell under that umbrella, and that was when it all changed.
I think I was 15. I became quite withdrawn from people. I'd generally been quite sociable. I was pulling out of activities, and I think from my parents, the thing they always said is it's something in the eyes. You know, for about 4 years I was just dead behind the eyes.
One of my friends keeps asking me, so when are you going to be better then? It's just me. Yeah. And if I'm on medication for the rest of my life, then fine, so be it.
For any other things.
Exactly. You do it for diabetes, you do it for, yes. Yeah, it's just me. And I think accepting that is one of the hardest things I've ever had to do.
Has anyone had sort of much input from the sort of medical profession, or?
I had the CBT, which I think for me has been the best. And the results are still showing like a year and a half later.
Because I've just finished a course of CBT, so... Yeah.
Did you find, because when I was going through it, I was so cynical about it, I thought, I don't know what I'm talking about, this isn't helping.
Sort of. I liked it because it seemed sort of quite practical, and like things that I could sort of stop and do. Yeah.
How long was your that initial course?
It was 6 weeks, so 6 sessions.
Once a week?
Yeah, so once a week for 6 weeks, and then there's like a sort of catch-up session in a few weeks' time.
Nothing's a quick fix. It's going to be a long time, but the recovery will come. And quick fixes don't work.
No.
So if you yeah, exactly. So accepting that, okay, it's going to take a long time, but the longer it takes, the more thorough, if you like, the recovery is going to be. Exactly.
It's kind of like when you want to lose weight, isn't it?
Yes.
If you go on a crash diet, you can easily lose whatever, but you'll go back on. You do it sensibly over a long period of time,
but like
you'll
you said,
maintain
I
it.
thought before I started reading about it, medication was to fix, to know the magic pill.
Everything would be okay.
Yeah. The purpose of medication, you're right, is to balance.
Yeah.
Then you can deal with
things.
Then you can be more proactive.
Get to a level that you can just, okay, then you can go outside and you can run and you can, you know, just get to work and but you're at
get dressed, have a
bath.
bath.
Yes. So I've started doing photography in the past couple of months. Nothing professional, nothing too great just yet, but having, I don't know, somewhere to go and for a reason, going for a walk for a purpose, and then coming back with something I can see. Wow, I did that, I saw that. I can plan things better now. I can plan to go somewhere, having a focus and an outlet. For me personally, it has helped me to, you know, sort of rediscover that purpose, I suppose.
I think you've hit the nail on the head with that. It's knowing that there's something just to occupy. But football, for me, when you sort of run so hard that there's just no energy left, I find at the end of that, and maybe the day after as well, that seems to be something that helps me a lot, which is why I have stayed on the football pitch, even after sort of injuries. Doctors have told me not to, but it's key for me. I can't do without it.
Running's like that for me. Yeah, it's it's my mind just goes, but it sort of seems to heal itself, if you like, while I'm running. It wanders off, doesn't really follow a thought process or anything, but it just frees my mind, I guess.
People understanding how you are and how you can be when you're in a certain frame of mind, for me at least, is absolutely crucial. Because if it wasn't for those things, then I would be exactly the same. I would remove myself from these social situations. I know that if I do go over the edge here, someone's there, yeah.
Just in knowing someone's there.
Even if it's just one person you tell, it's still one person who can help you. It doesn't have to tell the whole world. I think for me, I found that as normal a routine in the house was quite important. I didn't want people to tiptoe around me. I didn't want to be treated differently, because I think it makes you feel a lot worse. And I think that was the thing. Sometimes, you know, mothers quite rightly get very protective, and they can smother you almost by, they're worried, and they also, I think there's that instinctive, they fear it's their fault. And I think for my parents there was a lot of that, which made me less willing to talk to them, because I didn't want them to think it was their fault. It wasn't. It's nothing that they've done. It was that keeping normal around me, don't talk to me in a different way.
One of my friends just gets it absolutely perfect. When I'm doing the whole making dates to go out and then cancelling near the event, which happens all the time, she somehow knows, sometimes she has to ask me, but a lot of the time she just knows that I actually want company, but I don't want to go out. And she just turns up at my door. Yeah. And sometimes she just sits there and watches the telly with me. But she's, just a presence there. Just being there for someone and not judging them, I think, is the best thing.
Company is very important when we need it, not force company. Not let's all surround you because you're down. Let's try and cheer you up. No, when company through either invitation or through when a best friend knows, and so a little text, say, is it okay to call right now?
Yeah.
Or I'm gonna call you in 5 minutes. Is that okay?
Yeah.
Little, it's like signposting.
Yeah.
Or even just a silly picture message or something.
Some-
or just a little emoticon.
Someone's there,
Someone's
isn't it?
there, yeah.